Well, thank you. My name's Jack Hatch, and Senator Joe Bolkcom and I are here today to talk about an amicus or friend of the court lawsuit that's being filed today. We're joined by other Iowa legislators, and I'd like to have them introduce themselves.
Senator Pam Yocum.
Representative Anessa Kajtazovic.
State Representative Mary Masher from Iowa City.
Pat Murphy from Dubuque.
Representative Chuck Eisenhardt.
We're here because we're concerned about the status of health care in America and in Iowa. It's been under attack, as we all know, through the request by 26 Republican governors and attorney generals questioning the constitutionality of the law that we passed, Congress passed, and the President signed almost 2 years ago. We're concerned in Iowa because Iowa is one of the leaders in the country of health care reform. And we see the results of health care reform in Iowa, but one of the most striking examples of what can happen when states, with its partner in the federal government and private sector employers, get together. Iowa has the highest percentage of children covered under public and private health insurance in the nation. Almost 98% of our children are covered. That's what happens when we put a partnership together. However, after the law was passed last year, 26 Republican governors and attorney generals want a congressional do-over. They lost in the Congress of the United States in trying to find and reform health care. So what do? They throw a lawsuit that's now in front of the Supreme Court. And in that lawsuit, it challenges the constitutionality of some provisions of the law, but mostly what it does, it takes away the promise of health care to hundreds of thousands of Iowans, let alone millions of Americans. This congressional do-over is not going to happen. Now, Governor Branstad is a nice guy. We think he's trying hard to be a governor that represents all the people. But he's moving into an arena that he's now being viewed as a governor that wants to play politics with health care reform. If the lawsuit that Governor Branstad is part of will take all the benefits away that Iowans have received during this 18 to 24 months of the Affordable Care Act. And if it does, Iowans will be hurt. If he wins, Iowa loses. And why would we want to do that? Governor, if you're concerned about making Iowa the healthiest state in the nation, then we're asking you to withdraw your name from the lawsuit and participate in a bipartisan way with Iowans here to find ways of securing and ensuring that all Iowans have access to health care. Let's not play politics with people's lives. Let's sit down and work out solutions. Today, we're here because we are gathering with over 500 other state legislators who have signed on to the amicus brief, friend of the court. It will be delivered today at the Supreme Court with support from the Progressive States Network, the Working Group of State Legislators for Healthcare Reform, and the Constitutional Law Center in Atlanta, Georgia. That will acknowledge that the President and the Congress did the right things, that it is constitutional, that the federal laws requiring people to have insurance is not only legitimate but essential if health care costs are to come down and access to health care for all Americans will continue. They're playing with the probability that if this is found unconstitutional, then Iowans will be hurt. I'd like to ask Senator Bolkcom to come forward and to give you a little bit of what's at stake here in Iowa.
Thank you, Senator Hatch. Good morning, everybody. It's a pleasure to join my colleagues here and colleagues across the country that are standing up for the benefits of the Affordable Care Act. Here in Iowa, we've already seen, with the implementation of this important federal legislation, some very significant benefits to Iowa seniors. More than 10,000 have already received annual wellness visits under the Affordable Care Act. some 46,000 who have hit the Medicare prescription drug donut hole have all received a $250 tax-free rebate under this act. Seniors are receiving 50% discount on brand name drugs that they need, and that 50% will be completely eliminated as the donut hole is eliminated in 2020. More than 2 million Iowa residents with private insurance will no longer have to worry about lifetime limits. 226,000 residents who get individual coverage will no longer be denied if they fill out the application incorrectly. Younger people in our state, almost 9,000 young adults are now able to stay on their parents' insurance policy, and so almost 170,000 Iowa children will no longer be denied coverage due to pre-existing conditions. The Affordable Care Act is working. It's working to help employers. It's working to help families and people with chronic illnesses. We need to keep it going. We're standing here today to say to the Supreme Court through this legal brief that this is in fact constitutional, but moreover it's providing substantial benefits to Iowans across our state. So we'd be happy to take any questions you might have. We have a few more members that have joined us. We're pleased to be joined by Senate President Jack Kibbe, State Senator Joe Singh from Davenport, Senator Bob Dvorsky from Coralville, and we'd be happy to take questions, and we're pleased to be joined by all our colleagues this morning.
Have you contacted the Governor? The Governor's office, Governor's staff asked with this request formally, and have you had any response? Are you planning on it?
At this point, I don't think we've had a direct conversation with the Governor on this. We're as legislators joining this Friends of the Court brief, and we'll be sharing our concern with him rather directly.
Were you surprised to see him add his name to it when the Attorney General had decided not to have Iowa join that lawsuit in the first place?
Well, it's pretty clear that the debate over affordable health care in this country, and certainly the Federal Affordable Care Act, is a hotly political topic, and for some reason Republicans are opposed to the benefits that many Iowans are seeing. We'd like them to rethink their view on that. Health care is still the largest domestic problem facing our country. It's putting profound burden on employers, and it's stripping the wealth from American families. And the solution, the Affordable Care Act, is about trying to address some of that. We hope that Republicans, and especially our governor, as he talks about making Iowa the healthiest state, it's about making sure people have access to preventive service. It's making sure kids get the coverage they need when they need it. It's already working in Iowa, and we're here today to just say, let's keep building on it.
What was surprising was not so much that he joined the suit, because we think that's kind of political theater. When he announced that Iowa was going to be the healthiest state in the union, and then he accepts all the grants that's made available to the state through the Affordable Care Act, and at the same time sends a political message that he wants it repealed, that doesn't say much on whether or not he's willing to be a partner, as he has been in the past, on finding solutions to the biggest economic insecurity issue that we have right now, and that's the rising cost of health care for Americans and Iowans. So he's sending kind of a two-sided message. He wants to be the healthiest state in America, but then he wants the law that will help us become the healthiest state in America repealed. So we don't know really what his ambition is with this issue, or what his goals are.
Thanks for coming.
Thank you.
Appreciate it.